Hello everyone, Dr. Mike here. Today we're diving deep into a topic that might make some of you squirm: worms, or intestinal parasites to be more precise. We're talking about the top 10 signs that these uninvited guests might have set up camp in your gut. Now before you start squirming in your seats, remember knowledge is power. Recognizing the early signs of a potential worm infection is crucial to getting the right treatment and kicking those parasites to the curb. But first, let's break down what we're dealing with. Worms, or intestinal parasites, are organisms that live inside our bodies, often in the digestive tract, and feed off our nutrients. This can lead to a whole host of uncomfortable and sometimes serious health problems if left untreated. Let's talk about the first sign: abdominal pain. Now, we've all experienced a stomachache at some point, whether it's from that extra slice of pizza or a touch of indigestion. But if you're experiencing persistent or recurring abdominal pain, especially around your belly button, it could be a sign of worms. See, these pesky parasites can irritate your gut lining, leading to inflammation and pain. It's like having tiny little wrestlers going at it in your intestines, and trust me, you don't want to be the ring. The pain might be dull and achy, or it could come in sharp, stabbing cramps. You might even notice that the pain gets worse after eating as those worms start feasting on your food. Now, I'm not saying that every stomachache is a sign of worms, but it's definitely something to pay attention to, especially if it's accompanied by other symptoms we'll be discussing. So, if you're experiencing persistent tummy troubles, don't just reach for the antacids. Talk to your doctor to rule out any more serious causes, including those unwelcome worm guests. Let's move on to sign number 2, diarrhea. Now, we all experience the occasional loose stool, maybe from a dodgy takeaway or a touch of food poisoning. But if you're experiencing persistent or chronic diarrhea, especially if it's accompanied by other symptoms, it's time to consider the possibility of worms. Certain types of intestinal worms can actually interfere with your body's ability to absorb nutrients and water, leading to, you guessed it, diarrhea. They can irritate your gut lining, causing inflammation and increased fluid secretion. The diarrhea might be watery, bloody, or even contain mucus. Not the most pleasant topic, I know, but we're all adults here. The key here is to pay attention to the frequency and consistency of your bowel movements. If you're constantly running to the bathroom, or if your diarrhea is severe or long-lasting, don't hesitate to reach out to your doctor. All right, moving on to sign number 3, unexplained weight loss. Now, while many of us wouldn't mind shedding a few pounds, losing weight without any effort, especially if you haven't made any changes to your diet or exercise routine, can be a red flag. And you guessed it, worms can be the culprit here. Remember how we talked about those parasites feeding off your nutrients? Well, that means they're essentially stealing calories from you, which can lead to weight loss. You might notice that your clothes are fitting looser, or you might see a significant drop on the scale. This is especially concerning if you're also experiencing other symptoms like abdominal pain, diarrhea, or fatigue. Now, I know what you're thinking. Dr. Mike, couldn't this just be a sign of a fast metabolism? While that's possible, it's always better to err on the side of caution and get checked out by a healthcare professional. Let's talk about sign number 4, fatigue. We all feel tired from time to time, especially after a long day or a poor night's sleep. But if you're experiencing persistent and unexplained fatigue, that feeling of being constantly drained and exhausted, it could be a sign that something's up, and yes, worms could be the culprit. Remember, these parasites are stealing your nutrients, and that includes the essential vitamins and minerals your body needs to produce energy. Without those vital nutrients, your body simply can't function at its best, leaving you feeling sluggish and worn out. You might find it difficult to concentrate, you might feel weak and lethargic, and even simple tasks might feel exhausting. It's like trying to run a marathon on an empty stomach. You're just not going to have the energy to go the distance. If you're constantly feeling drained, don't just brush it off as being too busy or not getting enough sleep. Talk to your doctor to rule out any underlying medical conditions, including those energy-sapping worms. Moving on to sign number 5, skin irritations. Now, our skin is our largest organ, and it's often a reflection of our internal health, so it's no surprise that having worms can manifest as skin problems. Some types of worms can actually cause allergic reactions in the body, leading to itchy rashes, hives, or eczema. You might notice red, bumpy patches on your skin, or you might experience intense itching that just won't quit. These skin irritations can occur anywhere on the body, but they're often found on the hands, feet, or around the anus. Now, I know it's not the most glamorous topic, but we're all about breaking down those health taboos here. If you're experiencing persistent or unexplained skin irritations, especially if they're accompanied by other symptoms like abdominal pain or diarrhea, don't hesitate to reach out to your doctor or a dermatologist. Let's talk about sign number 6, sleep disturbances. We all have those nights where we toss and turn, unable to drift off. But if you're experiencing persistent sleep problems like difficulty falling asleep, frequent awakenings during the night, or waking up feeling unrefreshed, it could be a sign of worms. Now, you might be wondering, Dr. Mike, what do worms have to do with my sleep? Well, remember those pesky parasites are stealing your nutrients, and that includes essential vitamins and minerals that play a role in regulating your sleep-wake cycle. For example, some worms can interfere with your body's absorption of magnesium, a mineral that's crucial for relaxation and sleep. Without enough magnesium, you might find it difficult to fall asleep or stay asleep throughout the night. If you're constantly struggling to get a good night's rest, don't just reach for the sleeping pills. Talk to your doctor to rule out any underlying medical conditions, including those sleep-disrupting worms. All right, let's address the elephant in the room, or should I say the worm in the toilet. Sign number 7 is the presence of worms in your stool, and yes, it's as unpleasant as it sounds. Now, I know this is a visual no one wants to encounter, but trust me, it's better to know than to live in blissful ignorance while those parasites are thriving inside you. Seeing actual worms in your stool is a pretty clear indication that you have an intestinal worm infection. These worms might appear as thin, white threads, or they might be larger and more visible depending on the type of worm. If you do see worms in your stool, don't panic, but definitely don't ignore it either. Collect a sample if you can stomach it and contact your doctor immediately. Let's talk about sign number 8, nausea or vomiting. Now, we've all experienced that feeling of wanting to toss our cookies at some point, whether it's from a stomach bug or one too many slices of cake. But if you're experiencing persistent or recurring nausea or vomiting, especially if it's accompanied by other symptoms, it's time to consider the possibility of worms. Intestinal worms can irritate your stomach lining, leading to that queasy feeling we all know and loathe. They can also release toxins into your system, which can trigger nausea and vomiting. You might feel nauseous in the morning after eating, or even without any obvious trigger. And in some cases, you might actually vomit up worms, which is as unpleasant as it sounds. If you're constantly feeling green around the gills, don't just reach for the antacids. Talk to your doctor to rule out any underlying medical conditions, including those nausea-inducing worms. Let's talk about sign number 9, nutritional deficiencies. Now, we all know that a balanced diet is essential for good health, but sometimes, even if we're eating all the right foods, we might not be absorbing the nutrients we need. And you guessed it, worms can be the culprit here. Remember, those parasites are stealing your nutrients, and over time, this can lead to deficiencies in essential vitamins and minerals. You might experience symptoms like fatigue, weakness, pale skin, hair loss, or brittle nails. Iron deficiency anemia is a common complication of intestinal worm infections, as some worms can actually cause blood loss in the gut. If you're experiencing any signs of nutritional deficiencies, don't just start popping supplements without talking to your doctor. It's important to get to the root of the problem, which might just be those nutrient-stealing worms. Let's wrap up with sign number 10, gas and bloating. We all experience a bit of bloating from time to time, especially after a big meal or if we're feeling a bit backed up. But if you're experiencing persistent or excessive gas and bloating, it could be a sign that something's amiss in your gut, and yes, worms could be the culprits. Intestinal worms can disrupt your digestion, leading to a buildup of gas in your intestines. This can cause uncomfortable bloating, cramping, and even pain. You might notice that your stomach feels distended, you might experience frequent burping or passing gas, and your clothes might feel uncomfortably tight. If you're constantly feeling like a human balloon animal, don't just reach for the over-the-counter gas relief. Talk to your doctor to rule out any underlying medical conditions, including those gas-producing worms. So, there you have it. The top 10 signs you might have worms. Remember, if you're experiencing any of these symptoms, don't panic, but don't ignore them either. The good news is that worm infections are usually treatable with medication prescribed by your healthcare provider. Early detection is key to preventing complications and getting back to feeling your best. In the meantime, practice good hygiene, like washing your hands thoroughly before eating and after using the restroom, and make sure your food is cooked thoroughly. Stay healthy and take care.